a doctor in Idaho who once called the COVID-19 vaccine needle rape has been promoted to Idaho's top health board. This is Dr. Ryan Cole, a pathologist with no public health experience, who of course has been championed by the GOP in that state. He got appointed to this board at a time when there are raging cases throughout Idaho, to the point where they are sending patients into Washington because their hospitals are so overwhelmed. More about him, of course, Dr. Ryan Cole is a celebrated figure among anti-vaxxers. He made headlines in July calling the vaccine the clot shot and needle rape in a presentation to America's frontline doctors, a group known for COVID-19 misinformation. Oh my God, I can't believe there's a group called frontline doctors. Like, of course it is. Like essential workers who don't believe there should be a minimum wage. Like that's exactly like whatever they say they are, they're the opposite. So apparently one of the things he did and has done is convince a charter school called Peace Valley in Idaho to not wear masks. That was a sort of notch in his anti-vax belt. And he was appointed to the board at a time when only 38% of the state has been fully vaccinated. And the state system, the healthcare system, was at the brink. 2 weeks later, the system broke. 10 of the state's hospitals were put under crisis protocols, under which patients are told they may get care below the usual minimum standard, like being treated in makeshift wards or without proper equipment. On that same day, the day that they're like, you're gonna maybe have to be treated in a waiting room and or not at all and or in the parking lot, Idaho's largest public health board, the Central District Board of Health, announced that Cole would become its 7th member. The CDH is Idaho's biggest health authority, covering Ada, Boise, Elmore, and Valley counties. Its board is elected by 12 commissioners, 3 from each county. Cole made it onto the board thanks to a backlash against CDH restrictions, which propelled coronavirus skeptics into positions of power. So there you go. I mean, it's a democratic decision, Jayar, but that's what it is.
So this is how things work now. You can be a doctor that has absolutely no basis or background for the thing that you're now becoming an authority figure on, simply because enough people don't like what they're being told. You can say things like clot shot and needle rape, and that makes sense enough to people to promote you to a position where you'll be advising folks on what they can do going forward with their lives in a state where things aren't working out that well. So instead of looking for a different route, let's just make sure the people that are having issues or maybe aren't getting the right information continue to get the wrong information. Isn't there supposed to be a correction here? We just talked about the attempt at recalling Gavin Newsom in California. Their whole push was, we need to change the trajectory of our state. Things are going badly. If things are going badly, why would you put someone in that's gonna exacerbate it and make it even worse? I don't understand this process here. But a lot of Republicans that talk about going to see your doctor before you get the vaccine. Oh, go see your doctor, see your doctor, see your doctor. And by the way, I agree. Go see your doctor and have your doctor say what they should do about it. If your doctor says something like, oh man, I don't know about that clot shot, that needle rape. If you're sitting in your doctor's office and your feet are dangling off of the little bed, and the paper plastic under your butt that's really uncomfortable to sit on.
Yes.
And then everyone has experienced it, trust. And the doctor says, oh, you mean that needle rape? You should stand up slowly and be like, I'll be right back, I need to use the restroom, and leave. No one is gonna listen to their doctor in a one-on-one situation that says needle rape and clot shot, because it's crazy. But for some reason, if he's promoted to a public position, he can say needle rape and clot shot, and suddenly all of that is great. Why is that different now?
Yeah. Well, I mean, the other thing, and I didn't mention this, but yes, he is a doctor in front of his name, but he's not actually a specialist in any kind of virology or public health or anything. He's a specialist in dermatopathology, which I don't really know if I'm pronouncing right, but it's basically just diseases of the skin that have no relation to respiratory conditions like COVID-19, of course. But he is a celebrity. He's been on InfoWars. He's been lauded in by the Idaho Freedom Foundation. So he's a talk show darling, and that's all that it takes to be promoted nowadays, is to just be full of bluster. I mean, honestly, if Trump had lasted another term, I feel like this guy would have been next in line, right? To head like the Department of Health and Human Services. Yeah, Surgeon General, why not? Oh my gosh. But yeah, I mean, and Idaho, I know, is sort of like it is a battleground state. I mean, it is and it isn't. But I feel for a lot of people in Idaho who have been vaccinated. That 38%, 39% who have been vaccinated, who know that it is a red state, and there are a lot of people who are not going to believe in the vaccine. Of course, one last thing about this guy, he's one of those, the Delta variant is caused by the vaccine people. He told Insider he's concerned the vaccine is causing mutations like the Delta variant, a false claim that's been repeatedly debunked. He's instead promoted, drum roll, the anti-parasitic drug ivermectin as a COVID-19 treatment. The drug is currently considered at its best unproven, and it's at its worst a dangerous distraction from better treatment.
Again, we've said this so many times. So if you're gonna trust in ivermectin, who makes ivermectin? Who will prescribe ivermectin? People that make ivermectin are probably drug makers, and people who would prescribe it are probably doctors. So if you talk to doctors and then you don't trust drug makers, what would make you take this one? Because some politicians and pundits decide to promote it now. This, like the basis behind any of this, and this has been said before. It's not like that's a new thought process, but it's been said so many times that if you're gonna trust something, what's your basis for trusting it? You have to have this level of humility if you're gonna learn something.
Yeah.
So if you're gonna go into a situation like, oh, I don't know what's going on, what do I find out? Even if you listen to this guy, you have to at least have some level of humility to say this guy's smarter than me. That's not even what this is. He is saying what I need to hear to continue to believe what I already believed with no basis in fact and reality. That's all it is.
Yeah, and imagine him on this board. Like imagine the other healthcare professionals, people who went to school for public health, people who are like serving on this board, trying to prevent the skyrocketing cases in Idaho, prevent Delta from doing further damage, having to make patients go over to cross the border to get into Washington to be treated, and being like, how are we supposed to make it work with a guy that doesn't believe that up is up and down is down? Like that is, what is he gonna do? I feel like it's like a jury, but like a 12 angry men, except the dude who is decrying everything is actually wrong, and you're like, there's no middle ground there, right? Like how are you supposed to make ends meet? But that's of course because folks have been fed so much poison mentally, not through the shot, but listening to InfoWars and others, like that's what they want to see. That is who they want to support. That's who they want representing them in the highest health board in the state. And the last thing I'll say, you mentioned, why would you go see this doctor at all? And I think that's really interesting because people do tend to see, when it comes to this stuff with COVID, it's like people are going to see like chiropractors, we did a story about. They're going to see dermatologists. They're going to see, your local medicinal weed, prescription writer, dude. Like anyone who can write you a note that says you can't wear a mask because your back hurts, like, yep. And this is just another case. It's like anyone who did like 2 months of med school, let's promote them. And somehow that's more scientifically sound in these folks' minds than someone like Dr. Fauci. And finally, Idaho is a place where I know it's quite rural. And I imagine that most citizens of Idaho, residents, have a very difficult time on a regular day getting the healthcare they need, being able to access a doctor, being able to ask the questions that they want to ask about, their own health, about the vaccine, about the virus. That shouldn't be lost on all of us. That when we come out of this pandemic, we do need a more robust public healthcare system all over, so that we don't have these deserts of folks who are like, being fed so much misinformation because they really don't have a local doctor to see.
I wonder if that's part of it. There's a political angle to this. One of the part of this, we don't want enough people to have to feel they need to have this access to healthcare, which will again change the politics that we've always pushed. Because if something like this happens, the way this pandemic is hit. After something like this happens, people maybe have this awareness of, I don't have enough access to find out what's going on with true and accurate information. Maybe I should be given that through the amount of money that I pay back to my government. And maybe that's just something they want to keep people from having, so they pump the fear instead.
Absolutely.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.